welcome to the Healing Migraines Naturally podcast. I'm your host, Dr. Leslie Caesar, and I am a licensed naturopathic doctor. And I work with women all over the country who have chronic migraines, who want to stop having chronic migraines, they want to get off their medication, and they want to do it without having to take fistfuls of supplements to boot. Today, our episode is called Help! I Can't Get Off My Preventative Meds. First of all, preventative migraine medication. What is preventative migraine medication? So this is medication that is taken daily in the hopes of lowering the frequency and severity of the migraine flares so that you don't have to take as much abortive medication, right? So abortive medication is medication that you take to quote unquote make the migraine go away. And so that is medication that's taken as needed when the migraine symptoms start to flare. And preventative medication is taken daily whether you have a migraine or not. Maybe, you feel pretty good today. You're still going to take that preventative medication because the preventative medication, the theory behind that is that it's going to lower the frequency of the migraine flares and then the severity of the migraines themselves when they do happen. So the expectation when someone takes preventative medication, so like a lot of drug advertisements are around migraine preventative medication. So like I like to watch a lot of HGTV shows, like those house flipping shows. I really like those shows. So I watch a fair amount of HGTV programming, and obviously that channel appeals more to women, I'm sure, than men, and women are much more prone to migraines than men. And so whenever I watch HGTV, I see a lot of migraine pharmaceutical advertising, and that's generally for migraine preventative medication, right? And so when they kind of go through like the verbal fine print, right? They talk about like how great your life is going to be on this medication, and then the lady comes in and starts talking real fast about how it causes these side effects and, everything else. That little verbal fine print, they will say, a lot of the advertisements will say something like, patients that took Brelvy experienced a 50% reduction in their migraines, right? And so in conventional medicine, a 50% reduction in symptoms, so like if somebody went from 20 migraines a month to 10 migraines a month, that would be like a 50% reduction. That would be considered a tremendous success, right? That's like a blockbuster medication, right? Now, when we are actually looking at the human suffering here, we've gone from 2/3 of the month with a migraine, which is horrible, to 1/3 of the month with a migraine, which is still horrible, right? So the definition of success within like conventional medicine, the pharmaceutical industry, what's considered like a breakthrough is a little bit different than what we actually want, right? We don't want to spend any days with a migraine, right? The goal of preventative medication is not that you never have another migraine. It's that the migraine frequency, the migraine severity is less, and then you're still going to be taking your abortive medication on top of that when you have a migraine, right? So if I have 20 migraines per month, well, now I'm running into a problem because I can't take 20 Imitrex a month, right? One of the most common frontline abortive medication for migraines. That prescription that I'm going to get for that is only going to be 9 to 12 tablets per month, right? So if I have 20 migraines a month, now I have a problem, right? So now I'm going to be in that horrible place that a lot of my clients have been in, where it's like, I only have 12 this month. I know I'm probably going to have 20 to 25. So my, I can feel it brewing. I can feel something starting here. How bad do I think this is going to get, right? We do like the head check, right? How bad is this one probably going to get? because we get kind of tuned in, right? Is this going to be a really bad one? Is this going to be more of a mild one that I can just kind of white knuckle my way through? We develop that kind of sense, right? So we kind of go through this whole thing. Is this going to be a bad one? What do I have going on later today? If I really don't have that much going on, maybe I'll just suffer through. Is it going to be worth it to waste an Imitrex on this one, right? Because I don't want to take an Imitrex if it's really not going to be that bad, because I only have 12 and I know I'm going to need 20 for the whole month. So I don't want to waste my Imitrex on one that isn't going to be that bad. So I got to spend a couple hours thinking about that. How bad do I think this is going to be? Is this worth it to waste it? What do I have coming up? Maybe this weekend, right? So maybe I got this big thing this weekend and it's Tuesday. So maybe I just suffer, Tuesday and Wednesday and Thursday, because then I'll have, I won't have kind of burned through or wasted my Imitrex, and then I can use it this weekend, right? Anybody going through this, right? It's this exhausting calculation and mental, gymnastics. Do I want to take one of my abortives for this or not, right? So when people get into that situation, right, when the frequency of their migraines is in excess of the 9 to 12 abortive, pills that they have per month, they go back into their doctor and they say, you know what, I need more, right? You're only giving me 9. I mean, I'm getting 15, 20 a month. This isn't cutting it, right? And the doctor says, well, I can't give you more than 9. I can't give you more than 12. Number one, your insurance isn't going to cover it. And then number two, I would be going against the prescription guidelines. So this is what a lot of people don't realize. They think that their doctor won't increase the number of tablets per month because the big bad insurance company won't pay for it. There's something a little bit deeper going on here. Hi there, it's Dr. Leslie. If you're a woman having 8 or more migraine days a month, let's talk. I'll show you how to drop them to near zero in 90 days without adding more medication. In fact, you can even lower or maybe even completely wean off of your medication within 90 days and without agonizing cold turkey withdrawals. Let me tell you about my client Judy. She was on such strong medications for her migraines that she was nearly bedridden and could barely function. She had to close the doors of her small business and felt like a failure. She wondered every day, why am I doomed to suffer from these migraines? But just like you, she started listening to my Healing Migraines Naturally podcast, and a spark ignited. She knew that if she could just figure out why these migraines started in the first place, she could restore and recover her health again. So she booked her free consult call with me, and the rest is history. She now goes months between migraines and runs her small business full-time again because she's completely off of those preventative medications. She followed the 12-week plan and got incredible results. I've worked with women just like Judy from all over the United States overcome migraines naturally. So if you're serious about healing your migraines, then tap the link in the description and book a free consult call with me, just like Judy did. We do cap new clients monthly, so if the calendar's full, the doors are closed for now, so don't wait to reclaim the life you deserve to live. No matter how hopeless things seem now, with expert guidance, you can heal and recover from migraines. So I look forward to chatting with you. Click the link now to schedule your call. Your doctor and your insurance company doesn't want to give you more than 9 to 12 per month, because if you take more than that, you're going to have a high likelihood of getting into migraine rebound. Okay, so I did a whole podcast dedicated to migraine rebound. We'll link to that in the show notes. But your doctor doesn't want to give you medication in excess and then make you suffer even more because now you're in a migraine rebound situation. So the prescribing guidelines for triptan medication, which even with the new CGRP antagonist oral abortive medications like Nurtec, still the triptan medications are still widely used. If you take more than 2 triptans per week, you are in the danger zone of going into migraine rebound. So your doctor doesn't want to do that to you, and the insurance company doesn't want to pay for something that's going to put you in a worse state. So there's a rationale behind that. A lot of people get really mad and they're like, how come I'm not being cared for? How come my pain is not being taken seriously? It's not that it's not being taken seriously. It's not that the insurance company is just being a jerk. It's that both parties don't want to give you something, approve of something, pay for something that's going to make you even worse in the end. So once you start having more migraines than that like 9 to 12 range per month, then your doctor is going to say, look, I can't give you more Imitrex, but now we've reached the point where we need to put you on a preventative medication. And so the point of the preventative medication is not to completely take the migraines away. It's to lower the frequency and severity of the migraines so that you don't need to take as many abortive medications. So a preventative medication is something that you're going to take every day regardless of how you feel. So if you wake up and you're like, oh, doing my daily head check, I'm feeling pretty good, right? This might be a good day, right? You're still going to take that preventative migraine medication every day. And so no one wants to take medication, right? You didn't want to take the abortive medications. You certainly didn't want to take, 12 Imitrex per month. That was the last thing you wanted to do, but you did it because what alternative did you have? You had to get through your day. You had to go to work. You had to take care of your family. You had to do what you had to do. And with any medication, over time, it's going to work less and less well. And we've done several podcasts on this as well. I have a free training on this that we'll link to. But any medication that you take that suppresses the symptoms that your body is generating, your body is going to fight that and it's going to start to generate the symptoms more and more frequently and more strongly. The symptoms are going to get worse, they're going to get more severe, and they're going to come more frequently. So that's why when people start getting migraines, usually they are getting migraines infrequently and they're using over-the-counter medications like Advil, Motrin, Aleve, Excedrin, just things that they're buying at CVS or Walgreens. And when the migraines first start, those over-the-counter medications work well enough that people can get some relief, they can get on with their day. But because the health is continuing to decline, the body is going to make more and more migraines, and then we're suppressing the migraine symptoms with the Excedrin or with the Advil. So then the body starts making them more and more frequently and more severely, more and more severe migraines. So then we have to move to the prescription abortives like Imitrex or Nurtec. And then again, it's the same phenomenon. Everybody knows that the medication is not addressing the root cause of why the body is generating the migraines. It's just suppressing the symptoms. And so the body is going to start generating more and more migraines. And then you reach the point where you don't have enough abortive medication to make it through the month. And then you have this conversation with your doctor about going on preventative medication. So the most common preventative migraine medications are going to be things like Topamax, gabapentin, nortriptyline, blood pressure medications, typically something like a beta blocker, like propranolol. Antidepressants are sometimes used as migraine abortive or migraine preventative medication. And then sometimes people are even placed on anti-seizure medication like Keppra as a migraine preventative, or antipsychotic medication like Seroquel. Sometimes those medications are even used as migraine preventative medications. So typically, one preventative will be started first. So usually people are started on either a beta blocker like propranolol or something like Topamax. So it's usually going to be one of those two that people are started on first. And again, for most people, if they're not experiencing too severe side effects from those medications, if they can tolerate the medication, usually at the beginning, those preventative medications do have an effect where the frequency and the severity of the migraines improves. So we can go from 20 migraines a month to 10 migraines a month. That would be considered a blockbuster response, very good response. And then if I have 12 Imitrex, I can cover that, right? So with preventative medication, the expectation is you're still going to be getting migraines. We're just going to lower it so that you're not having to overuse your abortive medication. But again, the same phenomenon is going to occur. So what works in the beginning, the body is going to fight that. So if Topamax is used at first, and again, people can tolerate the side effects of severe brain fog and their hair falling out and their appetite tanking and not being able to eat very much. If people aren't suffering that much from the Topamax, eventually the body is going to fight the Topamax enough where, now the frequency of my migraines and the severity of my migraines has increased again, where now I can't get by anymore with my abortive medication. Right now, it used to be 10 and I used to be covered. Well, now it's 15 again, right? And I only have 12, so now I am not covered anymore. So then a second preventative medication is going to be added. So I have worked with clients that are on multiple preventative medications. I've had clients that might be on, 4 preventative medications. This in addition to migraine abortive medications. And let's face it, when people have that severe migraines, they're not just taking Imitrex as an abortive, they're taking other medications for migraine symptoms as well. So they might be taking an anti-nausea medication like Phenergan, or they might be adding on like a Benadryl kicker to things. They might be adding in a muscle relaxer. So by the time people have that severe frequency and severity, they're not just taking one Imitrex, they're taking an Imitrex with a Phenergan, maybe a Benadryl kicker, maybe a muscle relaxer on top. If it really gets bad, they got to add on a Fioricet. Okay, that's in addition to 3 to 4 preventative medications. Okay, trust me, this is not that uncommon. Okay, when this happens to people, it's highly likely that they're going to be very, very foggy. So they may not be experiencing like the brutal, agonizing, my brain is going to explode type of pain, but they're not feeling good on a day-to-day basis. They're feeling foggy. A common thing that people will say is, I feel like I got hit by a bus, right? So they're feeling foggy, they're very fatigued, they're having difficulty at work, even at home, they're there, but their mood is kind of flat, right? It's like kind of that spark is gone, right? So they're highly medicated to kind of keep the most severe, pain and nausea and so on at bay, but they're not feeling that great. Now, if this is you, I feel for you totally. This is no type of criticism or anything like that. I know that you got into this situation because you really were between a rock and a hard place, right? And it was truly a matter of functioning, making it through the day, keeping your job, taking care of your family, or taking this medication. I know you don't want to be on 4 preventatives and take this abortive medication. I totally get it, right? Now people are in a situation of, okay, how do I get off of these things, right? And so usually people will eventually kind of reach a stable point. So, all right, what used to be 25 migraines a month, now with, this whole kind of multiple medication, we got this dialed in with the neurologist, where I'm down to, 8 migraines a month. And my abortives, I'm not in agonizing pain. People kind of feel like I'm stable, right? I'm not great, but I'm stable. And I would love to come off of one of these preventative medications because I'm really struggling with the side effects, right? Like I say, at best case scenario, people feel real foggy and they just kind of feel like they're doped up, hit by a bus. At worst, people are losing their hair, right? They're having difficulty sleeping. Their digestion is poor. They're feeling really stiff. It's like I feel like I'm, 80 and I'm 40, right? So it's like, how can I, now that I'm stable, can I just get off one of these, right? Can we start to taper me off? How can I come off of these medications? So they go into their neurologist and they have that discussion. I want to come off of the medication. So this is what I see over and over and over again. Neurologists, they are very skilled at putting people on medication, but they're not that skilled at taking people off of medication. It's a real art form to take people off medication. So in order for me to get that license in the first place, maintain my license, I had to go through 4 years of fully accredited by the U.S. Department of Education and also regional accrediting bodies of a 4-year residential medical education. And I also had 2 years of clinical training. And then I have to do continuing education credits every year, including 10 hours of pharmaceutical continuing education to maintain my license every year. So I am fully trained in all of these medications. In the state of Arizona, I can prescribe all of these medications. Now, of course, my mission is to help people come off of their medication, right? Not put people on medication, but I am licensed and able to prescribe all of that medication because I am trained to do that. And so I have the expertise. I understand the mechanism of how the medication works. And I also understand the prescribing guidelines. So I understand the standard of care that your doctor, your neurologist should be operating under when they're prescribing you the medication. So I know when you tell me, well, the doctor told me to take this, take it like X, Y, and Z, I know whether they're actually telling you to take it correctly or not. And I find this sometimes too, where people have been prescribed medication and the doctor is not prescribing it correctly according to standard of care guidelines. And people aren't aware of that. Now, because I can prescribe medication, I can take people off of medication. Now, when I work with my clients, I do not change anyone's prescription, okay? Because I'm working with people all over the country. I am not changing their medication. I'm educating them and I'm helping them work with their prescribing doctor. It's illegal for me, since I am not their prescribing doctor, it would be illegal for me to change their prescription, and so I don't do that. But because I have the training and experience that I have, I can guide my clients to work with their neurologist or their primary care physician, whoever gave them the prescription. I can educate them and guide them on how to have that conversation with their prescribing doctor to come off of the medication. So what I see over and over again is that medical doctors, because they're not that experienced taking people off of medication, when a medication needs to be weaned off of. So these preventative medications, the typical ones that people are on that I've used as examples here on this podcast, those medications have to be carefully weaned off. If you were to be taking Topamax every day for 5 years and one day you wake up and you say, you know what, I'm really tired of taking this Topamax, I'm just going to stop, it's highly, highly likely that you're going to have severe withdrawal effects. You never want to just abruptly stop taking a medication. Most medications should be weaned off of, and frankly, even medications where technically the standard of care says that it doesn't have to be weaned off, you might want to wean off of that medication. Medical doctors, they're not that skilled at weaning people off of medication. And so when you go into your neurologist and you're like, you know what, I'd really like to get off of this Topamax. I'm feeling pretty stable. I'm not great, but I'm stable. And my hair's falling out and I can hardly eat anything because my appetite is tanked. And I'm so foggy I can hardly remember where I put my car keys. I'd really like to come off this Topamax. The neurologist says, well, okay, if you want to, first of all, they're a lot of times a little skeptical that this can even be accomplished. And so then they're like, well, okay, great. If you want to try to do that, just, cut it in half for a week, cut it in quarter for another week, and come off of it in 2 weeks. Okay? This is a recipe for disaster. I am not giving you medical advice on this podcast. Do not change any of your medication based on what I'm telling you on this podcast. I am trying to give you some educational information here and give you a basic understanding. Always talk to your doctor before you do anything. But that recommendation to quickly come off of that Topamax, if you've been taking Topamax for 5 years, coming off of it in 2 weeks is, for most people, going to be completely unrealistic. But this is what the doctor says, and so the patient dutifully follows the doctor's advice, and they come off of Topamax in 2 weeks, and then what do you know, 2.5 weeks later, they're in a massive migraine flare, they can't sleep, they're having tons and tons of bizarre symptoms, and, 5 days into a horrible migraine, they're back in the neurologist's office, and they say, well, I weaned off of this in 2 weeks, and now I'm in a 5-day flare. Now I'm in rebound because I had to take so many abortive medication so much. And the neurologist is like, well, what did you expect, right? You have a chronic condition. I guess you need the Topamax, right? So this is the number one thing that people say to themselves when they try to come off of a preventative medication and the symptoms come roaring right back. They have horrible, withdrawal symptoms when they come off. The first thing everybody says to themselves is, oh, I guess I needed the Topamax, right? Like, I guess I need... This is a horrible, horrible lie. So let's kind of break this down a little bit here. So first of all, if we haven't done anything to improve our overall health before we come off of a preventative medication, what do we expect to happen? Okay, so again, everybody knows that the medication is not addressing root cause issues and it's not improving our health, right? It's just kind of masking the symptoms that we're experiencing. So first, we want to improve our health so that our body is making fewer and fewer migraines with less and less severity of symptoms before we even consider touching preventative medication. So when I have a client that's on preventative medication, and this is like a big motivator for a lot of my clients. A lot of people reach out to me for help because they're taking preventative medication. Maybe they're already taking Topamax, their hair's already falling out, they're already totally brain fogged, the migraines are creeping up in frequency and severity, their neurologist is like, okay, we need to start a second preventative, or we need to put on a third or a fourth preventative, and, it's like, okay, I got to do something different, right? Because I'm already feeling doped up, now we're talking about another one, it's like, I'm done, right? And they reach out to me. That, a big motivator for my clients. I want to come off this preventative medication. I haven't felt good since I started taking this Topamax. They don't call it Dopamax for no reason, right? And so people are like, okay, I've had enough. The last thing I want to do is add more onto this. I got to get to the root of this, right? So they start working with me with a major goal of coming off, say, the Topamax. Now, they're already getting 10 migraines a month with the Topamax, right? And with each of those 10 migraines, they're already taking an Imitrex and a Phenytoin, maybe a Benadryl kicker on the top of that, right? So we're not even going to think about the Topamax until that migraine frequency and severity improves, right? So you can restore your health and the migraine frequency and severity can improve while you're taking Topamax, while you're taking a preventative medication. This is how I work. So we first identify what your body needs, that our body wants to get itself back into a state of health. Our body doesn't want to generate all these migraines. It's generating it because it doesn't have what it needs to function properly. And so when I work with my clients, the first thing that we do is we do an assessment that identifies, okay, what exactly does your body need? Then we put a game plan together to give your body what it needs. And then when that happens, your body is going to do what it is designed to do, which is restore itself back into health, into homeostasis, into equilibrium. And when that happens, it's going to generate fewer and fewer migraines, less and less severe migraines. So you take your abortive medication as needed, right? You don't take Imitrex every day. You take Imitrex when the migraine comes on. You don't take Phenergan with every migraine. You take the Phenergan when the nausea is really bad with any particular migraine, right? You don't take the Benadryl kicker all the time. You take the Benadryl kicker when the pain is so bad that you can't sleep at night and you want a little sedative, right? So as the severity of the migraines improves, right? So a migraine becomes less severe when the pain isn't as bad and, oh, you know what? Gosh, I used to have horrible nausea every migraine. Lately, I haven't been getting any nausea. So if you're not having nausea with the migraine, you're naturally not going to take that Phenergan, right? If you normally have migraines that last 48 hours, but now your migraines are only lasting 8 hours and you can sleep at night, you're not going to take that Benadryl kicker over the top, right? If the migraine isn't that severe, well, this is more of like a nagging thing. It's not like a full-blown, my brain is going to explode and I'm going to be in bed. It's more like this nagging thing all day. Well, you know what? Now I can take Advil, right? So literally, right, I have clients where they're taking, Imitrex, Phenergan, muscle relaxers, right? And they naturally will gradually sort of wean off those needed medications. Then we step them down to over-the-counter. Yeah, I know like a migraine sufferer, if somebody says, well, why don't you just take an Advil, and you just want to wring their neck, right? But when we get the severity down, you don't have to take 3 different abortive medications. You can get by with Advil. It's wonderful. And then it continues to get less and less severe. Well, you know what? It kind of nagged me all day, but I really didn't even need to take an Advil. I was able to make it through. And then before you know it, you're going 3 to 4 weeks between a flare. You haven't taken an abortive medication in weeks, right? So you're feeling better and better. The migraine frequency and severity has improved. Now is the time to take a look at your preventative medication. If you come off of preventative medication and you're still getting 10 migraines a month, what do you think is going to happen, right? It's not going to go well. Even if you wean down very slowly, etc. We've got to get you feeling better. We've got to get that migraine frequency and severity significantly improved. And trust me, you're going to be feeling better as a whole person also. Everyone that comes to me, they're like, just get my migraines gone, right? I don't care that I'm not sleeping that well. I don't care that I have to get up to urinate 2-3 times in the middle of the night. I don't care that every time I get out of a chair, my muscles hurt. I don't care about my heartburn. Just get my migraines gone. Well, I got news for you. All those things are going to start to improve if we're going to make any progress with your migraines, right? Because the rising tide of our health lifts the boats of all of the symptoms that we're experiencing. So, if we're going from, 10 migraines a month with preventative medication on board, and you're now like getting a mild migraine that you don't really have to take anything for, or maybe you're just taking a little Advil for every 3-4 weeks, and you're feeling better than you have in years as a whole person, now when you say, okay, let's get off the Topamax, right? So what I do with my clients, again, because I do not change their prescriptions, they work with their prescribing doctor to change their prescriptions. But also in my experience, I have the experience to guide people. If you're on 4 preventatives, which one should you wean off of first? And this is a conversation that I have found that neurologists, they really don't even think about it, right? The patient kind of comes in with like, oh, okay, I'm on, propranolol, Topamax, gabapentin, and Botox. But, I really want to come off this Topamax first because my hair's been falling out ever since I started and I have horrible brain fog, right? So the patient is coming in requesting to come off of the Topamax, and the neurologist is like, all right, we'll give it a shot. 2 weeks, right? Whatever. But that may or may not be the best medication for you to come off of first. And this is, again, where my expertise comes in. You might be better off coming off of the propranolol first. This is something where, because I know my client so well by this point, I know how their body reacts, and I know what their symptoms are. And I know, because I am medically trained, if we are dealing with side effects, what side effects are more likely to be from the propranolol, what side effects are more likely to be from the Topamax, because you can have overlapping side effects, okay? The propranolol can make some people feel kind of foggy like the Topamax, right? But again, because I have gotten to know my clients so well, I can say, okay, for you, I know you really want to come off this Topamax, right? Like, I get it. But let's start with the lowest hanging fruit. Let's start with the one where we have the highest likelihood of success, and you could probably wean down the quickest, right? And we get that off, right? We get an easy win, get a quick win, right? I might give that advice to my client and say, okay, when you go into your neurologist, have this conversation, right? So again, I'm not changing the prescription, but I'm educating my client on how to have that conversation with the neurologist. And then also, I'm educating them on what is a reasonable wean-off approach to each particular medication, so they're not put in the typical position of, oh, you've been on this medication for 5 years and we're just going to have you wean off of it in 2 weeks. And it's like we're just going to pull the rug out from under your body, right? So I'm guiding them, I think that this would be a reasonable wean-off schedule. It's probably going to take you, 2 months to come off of this Topamax. And so then they can go into the neurologist instead of just sort of like, okay, whatever they tell me, I guess that's going to be right. They're coming in educated. They can have the conversation. They know what questions to ask, etc. And then also they're going in and requesting a wean-off to like the right medication at the right time for them, right? In other cases, right, they may be on, propranolol and an antidepressant and a Topamax, and it's very clear that the Topamax is really doping them up, right? They're on the Dopamax instead of the Topamax, right? And so even though, another client, why don't we start with the propranolol? Like, I think you'll be able to wean off of that pretty quickly. We get a quick win, then we move on to the stronger stuff. But for another client, right, it's like every time I wash my hair, it's fistfuls of hair coming out, and like I can't, think straight. At work, I've just been like hanging out for a year, and I hope nobody notices, right? It's like, okay, this one, really, really severe side effects. We've gotten your body restored where you're only having a mild migraine, every 4 to 6 weeks. Let's tackle the Topamax first. Go into your neurologist. This is what I would think would be a reasonable wean-off schedule. Talk to your neurologist in this fashion, and then my client goes in with that education, feeling empowered, feeling like they know how to have that conversation and they know how to evaluate what the neurologist is telling them, right? So they're set up for success. So this is critical. Nobody has a Topamax deficiency. Nobody was born with a necessity for Topamax for their biochemistry. No one on the planet. But what's happening to people is they are being inappropriately taken. They're not weaning off their medication at the right time. It's not an appropriate wean off schedule. They pull the rug out from under their body and they have horrible experience. The number one thing that people say to themselves is, well, I guess I needed that. And that is not the case. Nobody needs Topamax. But you want to set yourself up for actual success. Coming off of a preventative medication, your health has to be restored to a certain point. It doesn't have to be 100%, right? But we've got to get your health restored enough so that the migraine frequency and severity is noticeably diminished, right? So then you can remove that preventative medication. You're not going to have a big explosion of migraines. That's the last thing that anybody wants. And so it's the right timing and then the correct wean off approach. So those are the two most critical factors for coming off of preventative medication. And these are things that when people go into the neurologist is not taking into any consideration. They're unfortunately, again, I'm not trying to be critical here. Neurologists, again, they are not trained to take people off medication. They're trained to put people on medication. So it's not their expertise. But they're not setting people up for success. And again, by the time we're on those preventative medications, we already feel like we're doomed and defective. Our body hates us. Something wrong with our genes, right? We're already struggling under that horrible mental weight of having these chronic migraines. And then somebody tries to come off of a medication, is not successful, and then it just is like, oh, I guess I needed that. I guess I really am defective. I guess there really is something wrong with me that I've got to have this medication for the rest of my life. All of this is avoidable. So if this has been your experience, okay, reach out. This is something that I can help you with. I have walked hundreds of clients through this process over the years. So please reach out to me and schedule a consult call with me. I would love to talk with you about what's going on with your migraines right now, what's going on with your prescription medication right now, and what your goals are around your medication, coming off any medication that you have. If you've tried in the past and been unsuccessful, it's not your fault, okay? It's not your fault in the least. It's not the fault of your genetics. It's not, your body doesn't hate you. I had a client, this takes the cake. Her neurologist told her that her brain had faulty wiring, and that's why she had the migraines. I mean, a neurologist said this, okay? None of this is the case. So if you've been unsuccessful in the past, it's just because you haven't been set up for success. So let's set you up for success so that you can feel better than you have in years, literally years, and I can help you work with your prescribing doctor and come off of these medications that are not getting to the root cause and are making you feel worse, definitely in the long term and even on a day-to-day basis if you're struggling with side effects. So I hope this helps. Let me know in the comments what experience you've had with your neurologist or your primary care doctor trying to come off medications. I'd love to hear from you in the comments. So great. Thanks for joining me today, and I will talk